Okay, this video is going to deal with hypnosis, so it's going to be real short. Hypnosis is simply a social interaction in which one person, the hypnotist, suggests to another, the subject, that certain perceptions, feelings, thoughts, or behaviors will spontaneously occur. People who are highly hypnotizable frequently become deeply absorbed in imaginative activities, and they have the ability to focus attention totally on a task. And there is some debate here whether or not hypnosis is actually an altered state, or is it just a level of deep concentration. However, people who have been hypnotized say that it is an altered state of consciousness, so for our purposes we are going to say that it is an altered state of consciousness. So can anyone experience hypnosis? Like I said, people who are highly hypnotizable frequently become deeply absorbed in imaginative activities. They have the ability to focus attention totally on a task. Hypnosis does not enhance recall of forgotten events and may even foster false memories. Postural sway, the way that you're sitting, can make a difference on whether or not you are easily hypnotized. Somebody who's standing up is not as easily hypnotized as somebody who is leaned back and relaxed on a sofa or something like that. Can it enhance the recall of forgotten events? No, it cannot do that. And it can, like I said, it can foster false memories. There used to be a really big push for hypnotizing people to help them, remember repressed memories, but that's not true at all. Can hypnosis force people to act against their will? No. Research indicates that hypnotized people cannot be made to act against their will any more than non-hypnotized people can, and that hypnosis can at least be temporarily therapeutic. It can be therapeutic. And people who practice hypnosis as a therapy, psychologists who do this are called hypnotherapists. And post-hypnotic suggestions have helped people to reduce headaches, asthma, stress-related skin disorders, and behaviors related to obesity. However, drug, alcohol, and smoking addictions have not responded well to hypnosis. And hypnotizable people can enjoy significant pain relief. Oh, did I just skip one? No. One theory finds the answer to pain relief in dissociation, which is a split between different levels of consciousness. So, explaining the hypnotic state, the belief that hypnosis produces a dissociation gains support from the fact that hypnotized subjects sometimes carry out suggested behaviors on cue, even when they believe no one is watching them. Furthermore, hypnosis is accompanied by distinct brain activity. And the divided consciousness theory of hypnosis argues that hypnosis involves dissociation that is more extreme than the everyday dissociations that occur in our information processing. Hilgard, a researcher who did a lot of work on hypnosis, suggests that dissociation accounts for a hypnotized subject's awareness of experiences that go unreported during hypnosis. Another psychologist argues that hypnosis is a byproduct of normal social and cognitive processes, and thus not quite a unique state of consciousness. And advocates of this social influence theory note that behaviors produced through hypnotic procedures can also be produced without them. And again, here's the definition for dissociation. Hypnotized people, for some reason I'm having a hard time saying that word, sorry. They might be acting out the role of good hypnotic subjects and allowing the hypnotist to direct their fantasies. Evidence for this view comes from experiments in which the researcher tells hypnotized subjects that hypnosis reveals their gullibility and they stop responding as directed. So most recently, researchers are moving forward and toward a unified account of hypnosis, which is a merging of the two views. And this is a good little chart showing you how hypnosis might work. hypnotizing this girl to try to divert her attention from a painful ice bath. And the divided consciousness theory is saying that hypnosis has caused a split in awareness, and the social influence theory is saying that the reason that this is working is the subject is so caught up in the hypnotized role that she's ignoring the cold. She's trying to play the part of a hypnotized person. And that's it. Thanks, guys.